Let's just hang on.
Okay, I'll put my on mute so somebody else. Bye-bye.
Good afternoon, ladies and gentlemen. This is July the 13th, special Board of Supervisors meeting. I'd like to ask the clerk of the board to see who we have on the telephone with us.
Supervisor Johnson?
Present.
Supervisor Gould?
Here.
Supervisor Angus?
Here.
And Supervisor Watson will not be joining us today, so we do have a quorum.
Okay, thank you very much. So due to the COVID-19 pandemic and current state of emergency, public attending in person must social distance and follow CDC guidelines, and face masks are required to be worn in Mojave County buildings. The meeting is also available to view electronically by visiting the Board of Supervisors page on the county website. I'm sure we have several people that are viewing with us today. So the Board of Supervisors may, by motion, recess into executive session to receive legal advice from the board's attorney or any item contained within this agenda pursuant to ARS 38-431.03A3 and 4. So the official business to come before the board today, I'm going to move some items around, and item number 4 will be heard first. Ms. Burley, if you don't mind, I'll take these out of order. This will be a discussion of possible action in regards to the proclamation on March 11, 2020. The proclamation granted authority to the chairman regarding imposing curfews, ordering closing businesses, closing public access, etc. This is brought to us by Supervisor Hildy Angus. Supervisor Angus, on the agenda item, I went ahead and approved it as a late add, but there's no recommended motion. So do you want to go in and explain what this agenda item is? Thank you.
Sure. Thank you, Madam Chair. I just thought that we passed that proclamation March 11th, I believe.
Supervisor Angus, Supervisor Angus, I just looked in the audience and see that people are not wearing their masks. So if I could at this time ask everyone to please put on a face covering or a mask unless you have an exemption.
I have an exemption. I have a medical condition that prevents me from wearing a face mask.
Okay.
I have an exemption. This is because of constitutional rights. I sort of defend it. I'm not going to do it.
I'm sorry, I couldn't hear you, sir.
Against my constitutional rights. I sort of defend the Constitution. I will. I'm here. Not looking on. You're going to throw me out, you throw me out.
Okay. Anybody else have an exemption?
We all do.
Okay. Will all of you not wearing a mask that have an exemption please stand up?
Have an exemption?
Okay, I'd like to ask the one gentleman that does not have an exemption to please leave the auditorium. I assume you're refusing to leave the auditorium, sir?
Well, I got a card here in my car.
Is the card a medical exemption? Is that what you're saying?
No, it's a religious. Look at the meaning. Look at the meaning. You're not going to watch it?
Attorney Esplin, can you advise on this case, please?
So the Board of Supervisors has required that all persons in the buildings wear a mask unless you have an exemption. We are not going to ask what that exemption is. There's various different exemptions there are. And if you have an exemption, then we respect that, absolutely. If you do not have an exemption and you don't have a mask, we have masks available for you that you can wear. But if you do not have an exemption and you do not have a mask, we ask that you leave the building because you're not permitted in here. So we'll ask you again, sir, if you do not have an exemption, to please leave the building.
So do we have security in the room?
Ron Gould
has left the conference.
Okay, Supervisor Angus, it looks like we're ready to hear your discussion now. Please go ahead.
Okay, but I was hoping, I just heard Supervisor Gould either was disconnected or left.
I think he
You know, if he's coming
disconnected,
back.
and you're difficult to hear again, so if you could speak up.
Really? Better? Is this better?
It's hard to tell because you haven't said much, but you're kind of breaking up a little bit.
Okay.
And, possibly.
I can. It's the best I can do. I'm not on a speaker. I'm on my regular phone, so there's nothing else I can do. But can you hear me if I speak like this?
Yeah, I can hear you better, and if you could just speak a little bit slower, I think that'll work.
Okay. Thank you, Madam Chair. So I brought this back. We first approved this March 11th of this year at the beginning of this whole, crisis, pandemic. It's interesting if you read the proclamation. At that time, we had no cases, and we used the 1999 ordinance to do this. But 4 months later, I just thought maybe the board would want to talk about it because there's no end date. We never talked about what that would look like, or, in the beginning, one of the reasons we did that, like we do all of our emergency proclamations, was because we have to, if something has to be done quickly, we have to announce and notice a meeting and things like that. But we now have a standing meeting twice a week, so I don't know what kind of emergency couldn't wait till the entire board. And just for the record, even if I was the chairman,
Has joined the conference.
even if I was the chairman, I would have brought this back for discussion because I just think it's something that the board needs to discuss if they want to just keep it or if we want to put some different qualifications on it or just put a date that it will expire. I just think it's important because it's just out there, and this 4 months later we have some differing opinions about everything, and I think that anything major would probably be best if it went to the whole board for discussion. So I'm putting I didn't put any kind of recommended motion because I just wanted to have it out there for discussion.
Okay, I'll open it up for discussion then. Supervisor Gold, do you have anything that you would like to add to this discussion?
I missed about 2 things of the discussion from a technical malfunction, but I don't really think that any emergency action should be taken unless they need to be taken sooner than we can call a special meeting, which would be 24 hours. So I would like to limit emergency actions to things that need to be taken action upon sooner than 24 hours. Thank you.
Supervisor Johnson, do you have any comments?
Thank
Thank you, Madam Chair. No, I don't have any comments. I think it just listed what powers it gives the chair, and I have no problem leaving it in place.
Okay. I don't have anything that I would like to bring up or discuss other than this would be a huge change in the middle of a pandemic, and there's a lot of resources that depend on this emergency order. So
May I ask a Madam Chair question?
yes, certainly.
Has there been anything thus far that you used it for that was an emergency with resources and things like that?
Yes, I believe the health director can speak on that, but there's been quite a bit of monies that have been available to Mojave County that would not be available without this emergency order. And because this is totally new to us, it's unknown, we have no idea from day to day what's going to appear and be something that needs to have a decision made immediately, especially since our board meetings are now our regular meetings are just once a month, and the COVID meetings are Mondays and Thursdays.
Well, in the proclamation itself, it says powers such as closing things and things like that, and that's the wording I have a bit of an issue with. Getting money, which again I don't really see why that would be like a 24-hour thing, why that would be of an emergency nature. And it's just getting money can be something that the chairman does, like we do all the time, and then we just retroactively approve it. But I can sort of hear the writing on the wall that without Supervisor Watson there, that any motion I would make would probably not go anywhere. So I'll bring this back at another time.
Okay, Supervisor Angus. And just so you know, 15 counties have an emergency proclamation that's in effect at this time. So, Supervisor Johnson.
But also what I wanted to say was that how long does it go? Like what are the parameters? What's the marker that would end it? When we have no cases? These are just questions that I think need to be addressed.
Okay, Supervisor Johnson.
It was Supervisor Gould. Madam Chairman.
Oh, I'm sorry, Supervisor Gould. I really have difficulty telling you apart on the phone. Go ahead.
Sure. I'm not talking about rescinding the emergency order. I'm just talking about limiting the powers of the chair during the emergency order. The money comes in because of the declaration of the emergency, but I have some problem vesting too much power in one person. And so what I would like to see is that those powers be limited to only things that need to be addressed faster than you could call a special meeting to do so, which would be 24 hours.
Okay, thank you.
Thank you.
Okay, if there's no further discussion, we'll go on to the next item. This would be item number 2, brought to us by the Procurement Director. Discussion of possible action to ratify the emergency procurement 20-EP-03 of a restroom and shower trailer from National Restroom Trailers in the amount of $66,957.14, including freight and use tax on behalf of Public Health Emergency Preparedness Department in accordance with Mojave County Procurement Code, Article 3, Section 8, for the provision of emergency preparedness equipment to Mojave County due to the COVID-19 outbreak. Mojave County will bear the initial cost posted to the Public Health Emergency Preparedness account number 273-45116-48530. FEMA funding from the state of Arizona's PHEP has been approved for reimbursement to the county for up to a total of $72,000. Tara, do you want to explain this to us a little further or answer questions?
May I take off my mask?
Yes. Yes, it's difficult talking with it on.
I mean, I can answer any questions that you have. So the health department received a grant related to the public health emergency response. The grant was for this restroom trailer. We did some initial research to figure out if it was going to be within my authority or if we needed to present it to the board. At the $66,000, I think it is, it does require board approval. However, if we waited to act, there's a chance that we would have had to wait until November for them to even start manufacturing. So that's why we move forward with an emergency.
Okay, does anyone have any questions for Ms. Acton?
Madam Chairman.
Supervisor Gold.
Ms. Acton, this trailer has holding tanks to hold the black and the gray water?
That would be a question. So we did work with our fleet manager as well, and I know that he did ask for a bunch of additional items related to the use of the trailer. I do not know if it will hold water, but I do believe it's intended to be a standalone unit.
So periodically, the honey dipper would have to come out and pump the tank out, I'm assuming?
I really can't answer that question.
The reason I ask is I'm trying to figure out what makes this better than us just calling the outhouse company and having them drop off 2 or 3 handicap-capable outhouses.
Go ahead.
Sorry.
Oh.
Hi, this is Kyle Frazier, Public Health Emergency Preparedness Coordinator. Can you repeat the question?
Let's see. Does it have holding tanks for the sewage?
It's so weird talking to a disembodied voice. I'm sorry, this is Tara again. And the procurement officer that worked on the quote just sent me a message and said, yes, it does hold both.
Okay. And so during the use of it, we would have to call the honey dipper truck to come out and pump those out periodically, I would assume.
I would assume you're correct.
And I'm curious what would make this better than us just calling the outhouse company to have them drop off a couple of handicap accessible outhouses in the event of an emergency?
The reason for that, in the event that, we may not have a guarantee that we can get an outhouse company to deliver in such short notice. We would have this trailer on hand, and it's not so much of the outhouses themselves, it also provides the shower facility. So we're bringing a shower that somebody can take a shower if they need to at one of these isolation centers that may not have a shower. So it's also that component along with the toilet.
So Kyle, will we be able to use this outhouse trailer for other events, or is it reserved for things under a declared emergency?
Currently, it would be used for shelter isolation sites. I think that's what it's going to be reserved for. It's going to be part of the public health department. As for other like extracurricular type events, I'm not absolutely sure of what the possibilities are that we could utilize it for such event, being that it's being purchased with COVID money.
Did anybody check on what the price is for if we were to buy our own handicap accessible outhouse? I guess it's the shower thing kind of mutes that, so I'll just retract that question. Thank you.
Okay, thank you. Anyone else have any questions or comments? If not, I'll entertain a motion. I'll make a motion. Okay, we have a motion to approve. I'll second the motion. All those in favor say aye.
Aye.
Any opposed? Madam Clerk, did you get the vote? Because I'm not sure I did. Maybe we should do a roll call.
Supervisor Angus?
Yes.
Supervisor Johnson?
Aye.
Supervisor Gould?
Aye.
And Chairman Bishop?
Yes.
Motion carries.
Okay, thank you. Okay, going on to the next item. This will be a discussion and an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19, and taking any necessary actions based upon those updates. Good afternoon, Denise.
Madam Chair, members of the board, thank you. Good afternoon. I'll start with my usual of the numbers. We have had a total of 1,814 cases in the county to date. We have updated our website, our webpage, to include 581 of those cases as recovered, and we have 93 deaths. And we continue to see the average age of the cases going down, even so slightly. It is now at 48.4 years of age, and our average age of deaths remains the same at 78.2. We've seen an increase in a couple of factors that are concerning, a couple of data points. One is that we've seen an increase in the ventilator usage at the hospitals for COVID-related patients. And we've also seen an increase in IC bed use for COVID-related patients. And so seeing that capacity level going down and smaller is certainly concerning. And of course, we continue to see growth in case counts in that 20 to 50-year-old category. That continues to grow fairly substantially at a much higher rate than the others. We are continuing to work with the various communities on increasing testing availability in their communities. We are working with local leadership, and then last Thursday we had hospitals participating on the call in North Country Healthcare. And we facilitate these meetings, or will be continuing moving forward these conversations twice a week so that we can continue to plan and look for opportunities to increase testing. Again, our primary focus in testing is our individuals with symptoms. In a prioritization list, that would certainly fall next, other than your congregate care, healthcare providers, vulnerable populations, and EMS. So looking at that that list as and then adding symptomatic individuals into that list. Just to let you know about the number of test kits, we've distributed 3,200 test kits in the last 2 weeks out to providers and facilities. Those are for use in their facility, their COVID testing, and then they use their respective labs to run those tests. We've also included on our website information about the LabCorp Pixel at-home COVID-19 test kit. On their website, there is a disclaimer that talks about the time frame for receiving results from those tests. Originally, they had a 1 to 2 day turnaround time. Right now, they're at 4 to 6 days turnaround time, for the very reason that everybody else is struggling with in terms of lab capacity to run the tests. So even if we had all the tests, we still have to have, test kits available to us. We still have to have the lab capacity to run those tests. So I know that ADHS is working on that locally meaning in our state, and they'll continue to do so until we have adequate lab supply and lab capacity to run those tests. Provide a brief staffing update. We have filled the 3 positions that you had approved, those data entry positions. Those are filled. We have interviewed and offered positions, and those people have accepted for 6 of the 10 community health education specialist positions. We are interviewing for the community health specialist senior position. That'll be the supervisor role over those other community health education specialist positions. We've received 1 applicant for the 4 nursing positions, and so we don't feel like that will be overly successful, but we'll continue to keep those posted. And Human Resources has been reaching out to different groups to try to increase that recruitment effort. And there were 2 office specialist positions, we're going to be asking if HR can help us with the interview and selection process for those 2 positions. And the epidemiologist position that's listed is the one that Mayor Schumacher is filling right now for us. So that's not a new position, it's just a position to be filled through CARES Act funding for now. We're going to be working with IT and HR on logistics related to hiring individuals that are remotely located. We have a great deal of expertise out there and individuals looking to assist. And we have, I can speak for at least 2 of those 6 health educator positions. Those positions are looking to, one's in San Diego and one's in Washington State. So we'll be working with HR and IT to set up remote employment relationship there. And finally, as far as discussion around recent happenings, as you know, the governor's executive order from last week, that's 2020-47, does actually have provisions in it for enforcement by our environmental health crew. And so we're looking for some guidance on how we approach that work. And I have Ron Balsamo here as well. He's the EH manager for that division. And he can speak to what we've already incorporated into our inspections and our visits. But I suppose where we're really looking for that guidance is more along the lines of when we receive complaints that a business is not following that and how you wish us to proceed with that. And for me, I'm just being mindful of the fact that these individuals have full-time jobs already in doing inspections. So the complaint investigation, which we do follow up on food complaints anyway, but I want to ensure that that does not overwhelm our normal responsibilities. So looking for strategies and methods that we could, that we can implement that would help us with that. So with that, I'd like Ron Balsamo to come up briefly and talk about what steps they've already taken, and then we can address any questions that you may have.
Okay, thank you. Good afternoon.
Oh, good afternoon, everyone, and Supervisor Bishop. Mr. Elters, it's a pleasure to put a face to a name. I've been reading a lot about you, and it's nice to actually have you in front of me now. So very briefly, when the pandemic started and we started receiving, governor's executive orders, obviously at that time there was some debate as to how voluntary this was and how much enforcement should be occurring and who should be doing the enforcement. And in this last executive order, he finally specified, all right, environmental health, health department officials, cited the statute 36601A, and okay, that's us. So what we have done thus far is simply incorporate into our normal inspections, which occur in restaurants either annually, biannually, triannually, depending on the type of permit that they have. Very simple, take a look around. Are the employees wearing masks? Are the patrons spaced at least 6 feet apart? Are they encouraging patrons to wear masks? And is the capacity legal? And under the regular capacity are now under 50%. And so at this point, we're strictly educating. Now, depending upon where the board wishes to go with this and how far the governor wishes to go with this, we can move on to asking compliance, demanding compliance, and then finally enforcement. With 36601A, right, that will give us the authority to shut down a business that refuses to comply after repeated complaints. However, we always begin with education, and we always follow that with polite requests for compliance once they've been educated. And so right now, we're still in the education phase. We're just letting them know if they're not in compliance, and if they are, we're letting them know that too. Because, one of the best things that an inspector can do on an inspection to develop a good relationship is to call them out when they're doing things right.
Sure. Okay. So does anybody have any questions for Ron?
I do, Madam Chair.
Okay, go ahead.
So what is the recommendation from staff on what they want us to approve?
Supervisor Johnson, I think what we're looking at is continuing on with that track. And I guess when we're looking at complaints, we can certainly follow up with a complaint. And then we can track those and come back to you if those seem like they become numerous in number. And then we may ask for some additional assistance in the enforcement piece there. And I think at some point, depending upon the case, if it's rather contentious, we may ask for some assistance from a Sheriff's Department employee, a deputy, to help us with the enforcement piece of that as well. Typically, in a food code situation, we wouldn't need that, and in most public nuisance, but this whole topic can be somewhat contentious, and we do want to make sure that our staff feel safe. And if they don't feel that in going back to inspect a facility, we would likely request that assistance. So if that seems like a sufficient track to take and path to take, then we'll continue down that road, and we can keep you apprised of any changes and any requests that we may have to change that protocol.
Madam Chair, Director Burley, I guess my position is, if we're dealing with regular health code violations on a daily basis like your department does, I have no problem with the feel-good attitude. When we're facing a pandemic, I think our feel-good attitude needs to be shortened a lot.
So do you have, Supervisor Johnson, some suggestions or recommendations for how we would modify our current plan to meet a shortened time frame or meet that goal of yours?
Well, it obviously need to be a board decision, but my opinion is if you go down, everybody knows what the rules are now, every restaurant and bar. If they're in violation, if we go down and say, hey, you're in violation, clean up your act. If they don't do it, we post it and shut them down. That's just my opinion. Okay. Everybody else will get the word and everybody will comply then.
Okay, thank you.
Okay, Denise, I don't disagree with Supervisor Johnson. I think we should start like you're doing now with education or a verbal education, and then if that doesn't work, a follow-up with a written warning. And if that still doesn't get compliance or near compliance, then I think we need to reevaluate and figure out what we're going to do at that step, because we don't want to be the mask police or the food police or anything like that. But if somebody is blatantly disregarding the safety of others, I think it's our duty to step in and take some type of corrective action. Those are just my thoughts. Supervisor Angus, do you have any comments?
Ron, have you had anything like this? Has it been a problem business that has blatantly, to your face, told you that they're not going to comply?
Supervisor Angus, thus far, no. We have had at least 2, perhaps 3 complaints about restaurants where employees were not wearing masks, and when an inspector went over to the establishment and had a discussion with the managers there, they agreed that it would be a good idea to do, and they went into compliance. So we have not we have not had open defiance saying, no, we're not going to do this, we don't care what the governor says. We haven't experienced that yet.
That's good.
Right. And I really don't think you will. I mean, people need to keep their businesses open. So, like Chairman Bishop said, it seems we're going the right way. If things change, then I would ask that you bring it back to the board.
Yeah, certainly. As I mentioned before, in our typical, with the food code, if it's a non-critical violation, we do educate, then we ask for compliance, then we demand compliance, and then finally enforcement is our last option. And so if we get to the point where, asking for compliance doesn't work, I think we certainly would seek further guidance from the board at that point in time.
Very good. Thank you. Thank you, Madam Chair.
Okay. Anyone else? Supervisor Gold, do you have anything?
Thank you, Madam Chairman. They should probably just continue the way that they're handling it. They should let them know that they're out of compliance and explain how to comply. And then if they comply, they're fine. If they don't comply, then you can go ahead and put the threat out to close them down.
Okay.
I have a question for Attorney Esplin on this issue, though.
All right, go ahead.
Ryan, does a customer have a private course of action if he thinks that he's being harmed by businesses not making their employees wear masks?
Supervisor Gould, that's a good question. Typically, when someone, let me kind of back up a little bit just so that everybody's aware. A private cause of action occurs when the legislature will pass a law, and if somebody is violating the law, sometimes for some of those laws, the legislature will allow them to sue because of a violation of that law. So basically, there's a law that is in place, and if somebody has violated it, the legislature has authorized that person to sue because that person violated the law. And it's not always that the legislature will specify it. Sometimes the courts will say, okay, a person can have a private cause of action under certain circumstances, very limited circumstances. In this one, I don't see that. I was just looking at the statute, and it doesn't appear as if there's any private cause of action that these laws would allow that person to do. And so instead, the person could still sue under any kind of tort theory, so they'd be able to say, hey, I was sick because of the actions of the other person. The business had a duty to have a clean, safe environment. The business breached their duty, and because of the breach, I have been harmed. That's the classic tort theory. And it would help that theory that, hey, this person violated the governor's orders, but it would not give them an automatic private cause of action. I don't see that, but they could still sue under classic tort theories.
Since this rule did not go through the legislature wouldn't have had anything to do with it. So it'd be really a gray area.
Yeah, I emphasize, a lot of the times the private cause of actions are created by legislatures. The legislature specifically says this person is authorized to sue if another person violates it. And so that's typically how it's created. And so in this instance, we don't have that, and you're exactly right, the legislature didn't pass that. So there likely would not be a private cause of action. But again, somebody could sue under classic tort principles.
Thank you, sir.
Yep.
Okay.
Supervisor.
I have a couple questions if Ms. Burley's done.
Well, Supervisor Johnson, if I could circle back to a question that you asked last Thursday that I didn't follow up with you on. I believe it was you that mentioned that there was a KRMC or an individual that went to KRMC with symptoms and went to the ED and was turned away from and wasn't tested at that place. I did check in with KRMC staff and learned that if that person had been admitted into the hospital, they would have tested them. Otherwise, what they're doing is asking those individuals to go through their Care Anywhere telemedicine site to go through the screening, and if they meet the screening criteria for testing, those individuals will be scheduled for a test at that point. So that's why that person wasn't tested in the ED.
Thank you. I think the major problem with that was they were refused in Havasu, the hospital, and sent to Kingman, and then refused up there. So maybe we need to do a better job of getting public information out that says, hey, you need to make a call and make an appointment or something, so they don't have to drive, 60 miles to find out they can't get it.
Certainly, yes. I would agree with that.
And to follow up, I just wanted to thank your department for getting the tests down here to Lake Havasu, as we were running out of them completely and unable to give tests. And hopefully we're getting some more so we can continue to test down here for the people who need it and want it. Also, another question would be, do you think that we might be needing more physicians to meet the increase in cases? And possibly, if we're having trouble hiring people, should we look at raising the hourly rate to attract people?
So I do think if we can bring specifically these community health education specialist positions, once we get them on board and all 10 of those filled and trained, I think that will assist us with our management of cases and investigations. I think I would wait to request any additional resources until we have those people on board and can get a feel for whether or not that will meet our need, or if we continue to see that rise in cases, that dramatic rise in cases, we may circle back to the board and request some additional positions to fill. Had we been able to fill the 4 nursing positions, those would have also had an investigative role in that position. So, if nothing else, we revisit that piece of it, continue maybe to recruit for nursing staff. However, knowing that that's difficult, we would maybe move to hire more community health education specialists that we could train to fulfill that particular role. That's not ideal because there are some nursing tasks that we're looking at not expanding, but building on, and that would be, for example, doing specimen collection out at long-term care facilities where there are cases, and we need to do some really immediate follow-up. That takes a considerable amount of time from our current nursing staff, and we'd like to, if we had a few more positions there, it would allow us to not get stretched really thin there. In terms of the pay rate, I would say that if we're looking at that from a perspective that it would include some of my current staff, because what I would be most concerned about is that we would pay an incoming, even a temp nurse, more than what my current staff are making. And so in looking at that, we've been discussing this, the balance of this, of getting some assistance and what steps we need to take, and also looking at the current staff and how they might perceive that.
I can understand that, and especially with the staff you have now, and that would probably be up to HR and the manager to figure out.
Sure.
Even if it was a temporary bump in pay while this went on.
Certainly.
But I just think it's a good idea. We make sure we have enough people to handle everything while the pandemic's going on.
Did you have anything else, Supervisor Johnson?
No, those are all my questions. Thank you, Madam Chair.
Okay, Denise, how are we doing getting the test kits out into the communities, to our providers and things? I know you got 3,000 test kits and have plans or hopes to get more.
Right. So we've distributed, as I mentioned earlier, 3,200 out to the communities in the last couple of weeks. We still have some available, and we're continuing to distribute those out based on orders, basically a resource request list that providers submit to us, and then we fulfill that order. So we'll continue to do that. And then we've ordered an additional 5,000 test kits. It's not clear at this point when we will receive those. ADHS, as I mentioned last week, I believe, receives these they receive the shipments from the federal government, and they're not always on a real set schedule, I guess is where I'm going. So they might get a shipment every week, and then they may not get a shipment for 2 weeks. So as soon as we receive those test kits, we will notify you and, of course, our community partners and the facilities so that we can get them out as quickly as possible and get them distributed.
Okay, thank you. Any other questions for Denise?
Madam Chair,
Madam Chairman.
I have a couple of
Supervisor Johnson, go ahead.
Supervisor Gould.
Or Supervisor Gould.
Denise, there's a report that is confidential that we as supervisors receive a couple of times a week. And it has a percentage of the people that are recovering at home versus the people that are recovering in the hospital. Is there any reason that that cannot be released to the public?
The report that you're referring to, Supervisor Gould, the daily report that you receive Monday through Friday?
I believe so.
Right, okay. The reason that we don't provide that out is that you remember how we talked about reviewing the accuracy of data for the daily reports, the daily case summaries that we submit at the end of the day? So this report that you receive in the morning includes deduplication of case counts. It includes any kind of cases that were removed from our jurisdiction. So in other words, this is clean. This includes all those corrections that are made. Whereas the website, we update that information and make all those corrections based on the recommendation of the board once per month. So it doesn't appear every day as, that language that we were saying, X number of cases were deduplicated and so on. So my concern with sharing that to the public is it's, A, going to show different data than what you see on the webpage, and secondly, and the confusion that might create when it's really about not including, or that daily report you receive includes the deduplication work that we do, whereas the website only does that once per month. That makes those corrections.
That's not my question. My question is the percentage. There's a pie graph that shows a percentage of people recovering at home versus a percentage of people recovering in a hospital. Can that percentage be released?
Yes, it can. I'm sorry, Supervisor Gould. I didn't understand the question, but yes, it can. Absolutely.
Okay. Would you care to release it now?
So right now, on today's report, for example, and basically the disposition is that it's at the time of the report. So this does not mean that a person isn't hospitalized after this is reported. So that needs to be made clear. So this is at the time that we receive the report, 7% of the individuals and the cases were hospitalized at that point in time, and the remaining 93% were recovering at home.
So if I extrapolate that and remove the recovered and the death, it looks like we have approximately 80 people in the hospital.
Approximately, yeah.
And 1,060 recovering at home.
I would say that's probably pretty close, yes. Mm-hmm.
Thank you, ma'am.
Mm-hmm, certainly.
Okay, anyone else?
Chair?
Supervisor Angus.
Thank you. Denise, can we talk a little about contact tracing? I got a couple of inquiries from constituents, and they're listening today, so I want to make sure they understand. So the question was, how deep do you go with contact tracing? The situation is that somebody at a relatively small retail business was tested positive, and they wanted to know if the county calls the people who work there or lets the company know.
So,
and then if that happens, And if that happens, what are they expected to do?
So we follow up with the positive case first, and those individuals will share who those close contacts would be. And if they're coworkers at a facility, then we would then call those coworkers and notify them. It depends on the number of cases and the size of the facility as to whether or not we would have a conversation with any of the management at that facility. Because if that number, of course, if you have a employee that lists 10 of the other employees that were close contacts, then those would be our next line of conversation is with those close contacts and who they've been in contact with, of course. So actually, we don't take that step. I'm sorry. We only do investigated the positive case and close contacts. So we don't take it another layer down. So that is where, we really haven't had to, because generally speaking, the management has known about the cases, or those individuals have to really, they have to isolate themselves, quarantine, and so they're really out for at least a minimum of 10 days. So an employer generally knows.
Okay, so the patient, the one who tested positive, would have to literally name the names of the people they work with. It wouldn't be like I work at this place and then the county would go in and ask for the names of the people who work there. I mean, we don't go that into the weeds.
Correct. That's correct.
Okay.
We would ask that positive case to give us the names of those individuals that they were in close contact with and contact information.
Okay, and how long after someone is tested positive would those people be contacted?
It depends. So typically anymore, some of these lab results are not coming back till, actually we had a case where the lab result didn't come back for 11 days. So those close contacts probably haven't been contacted yet, even though the main case is outside of the quarantine period.
Well, no, but wouldn't you get those contacts after the test comes back?
Mm-hmm.
You don't do the contact tracing before someone is tested positive. So this is after the test.
Right.
All right. So I guess my question is, are we lagging a little behind? Which would be, nobody would not understand that.
That's
given,
correct.
The case numbers that have gone up.
Correct. Yes. I think that's a fair statement, Supervisor Angus.
And so Norquest, which is the lab that does the majority of the testing, they report to you immediately, like at the same time, as soon as the test comes back, at the same time they report to the patient, they report to the county.
There can be about a 24-hour lag time to that, because it's part of an electronic lab record system. So based on conversations I've had with staff in the past about that, I've been told that it could lag by about 24 hours, that notification process. So to county health.
So once again, for clarification, if the employee names names, gives you names, you will contact them within, 24, 48, 72 hours?
I would say it's probably taking us, you know what, I need to actually do a little bit of homework to answer that question accurately, Supervisor Angus. I don't want to throw out a number that's not accurate.
And then when you contact them, do you recommend they get a test? Do you tell them where to go to get a test? Or is our job just to let people know that they may have been in contact with somebody who is positive?
We actually ask them to monitor for symptoms, and we ask them to take all precautionary methods, wearing a mask and other things that will help prevent the spread in the event that they are not shedding the virus yet, not contagious, and they're not, it really hasn't, they haven't seen symptoms yet. So we're asking people to take those steps.
And if it's been a week to 10 days, between the positive and the time test comes back, and then you contact the people, if they haven't had symptoms from this contact in 7 to 10 days, they probably don't have it, correct?
Probably. The average number of days it takes to, the incubation period is about 4 to 6 days. So, but people are being instructed, of course, because it can occur up to 14 days to actually quarantine for that period.
Have we seen that? 14 days contact? Like it hasn't, but again, how would you know? I mean, honestly, if somebody says that they had contact with this person, 2 weeks later, they get it, it could have been something in between. I mean, it's not an exact science.
Yeah, and it's uncertain where they might have been exposed also, right? So they could have been exposed in multiple different locations, so to tie it back to one person might be more difficult.
Right.
Certainly.
Right. So, we're doing the best we can.
Yes, absolutely.
Right. Okay, and the same person, this is a little bit more troubling, said that somebody they know tested positive and actually worked in a business that caters to an older crowd, and that do we do anything different if that's the case to protect the people that we say we have to really go out of our way to protect, the more vulnerable people?
It depends on if it's a congregate setting. The answer is yes. If it's a typical business environment, oftentimes it's just part of the investigative process. And our hope, of course, is that those individuals that have tested positive also talk with the business themselves and share that information if they're concerned about some of their patrons.
Okay. Well, thank you very much, Denise. That's all for me for today.
Certainly. Absolutely. Thank you.
Okay, does anyone else have any other comments or questions for Ms. Burley? Okay. Do you have anything further for us?
I do not.
Okay, thank you very much.
Thank you.
So we'll go on now to the next item. It's be a discussion and possible action. Receive an update and legal advice from the Mojave County Attorney's Office and Keller Rollback concerning the multi-jurisdictional opiate litigation in the United States District Court for the Northern District of Ohio. Further approve attorney-client privilege actions related to the case and authorize the County Attorney's Office and/or Keller Rollback to participate in settlement discussions and execute documents that further or enable settlement negotiations. So Attorney Esplin, do we need to go into executive session for this?
Yes, we're recommending that the board go into executive session.
Okay. I'll entertain a motion.
Motion to adjourn into executive session.
Okay, I'll second it. All those in favor say aye.
Aye.
Okay, we will adjourn now into executive session. right, do I need a motion for that, Ryan?
No, we've just adjourned. We're
Okay,
done.
we're adjourned from executive session then and back in regular session. And I even hit the gavel.
What are we doing? Are we going to continue it? Can we?
I need a motion to continue the item until next Thursday's meeting.
Yes.
Right?
Correct.
Yes. So I will make that motion that we continue this item until next Thursday's meeting.
Second.
And we have a second. All those in favor say aye.
Aye.
Any opposed? Okay, motion passes, and we are adjourned.
Ron.